Hi, Dr. Carolyn here. Hope you're having a good day wherever you are. Today we're going to be talking about a little bit of something science nerdy, and that's the intergenerational trauma and its impact on the dopamine system. So I think a lot of people know about the dopamine system. It's involved in motivation, reward, and pleasure. And research suggests that severe stress and trauma, especially when it's in early life, can lead to long term dysregulation of the dopamine system. So, this disruption of dopamine may then get passed down to subsequent generations through epigenetics. And we've talked about epigenetics before, I don't want to go into that again, but it can also impact parenting behaviors. Now, here's a story to help you understand. This is about a woman by the name of Claire. She's a 30-year-old whose parents survived the Rwandan genocide before she was born. Though financially stable now, Claire struggles with feelings of emptiness and lack of motivation. She'll binge watch TV shows for hours trying to feel something. And Claire has been in and out of depression for years, and nothing seems to really help. She can't find anything truly rewarding. At family gatherings, her parents' cultural traditions fail to resonate with her. She just feels numb. So, I'm going to ask you to reflect. Can you relate to Claire's sense of numbness and lack of motivation or drive? When do you notice struggling to experience joy, satisfaction, or purpose? Well, the dopamine reward pathway in the brain plays a crucial role in motivation, pleasure, and reinforcing behaviors, getting you to do the same things over and over, like exercise. When this system gets dysregulated from trauma exposure, including intergenerational trauma that's been passed down from your grandmother to your mother, etc., it can significantly disrupt healthy reward processing. So if you have an impaired dopamine reward systems, you can have difficulty finding pleasure in anything, and also difficulty in feeling satisfied from normally rewarding activities and relationships. And this can drive other behaviors to compensate, other behaviors seeking reward, like substance abuse, eating disorders, gambling addiction, and so on. And those are all in an attempt to artificially stimulate dopamine and feel that temporary relief. So, research shows that offspring of trauma survivors experienced reduced dopamine response in the brain reward region, and that then correlates to higher rates of addiction, post-traumatic stress disorder, depression, and other mental health issues. So these inherited dopamine deficits may be what underlies the feeling of emotional numbing or the inability to feel pleasure and then self-medicating urges. So when it comes to eating disorders, for example, intergenerational trauma is linked to disrupted dopamine signaling in the brain that govern the motivation to eat, the feeling of fullness, and the rewarding aspects of eating behaviors. So this can, we think, contribute to disordered relationships with food. Chronic dopamine dysfunction or dysregulation also, as I mentioned, reduces motivation, focus, and the ability to experience normal rewards like social bonds, and symptoms that, again, that can be passed through families with unresolved trauma histories. So just think about that. And how does this relate to intergenerational trauma? Well, in a study done on intergenerational trauma in Holocaust survivors' offspring, researchers found that changes in the dopamine receptor binding and release compared to control groups was abnormal. So similar dopamine changes have also been reported in studies of Native Americans dealing with historical trauma. So this is an important thing to recognize. there are several potential signs and symptoms that could indicate that your dopamine reward system has not been functioning very well, or that it's been impacted by trauma, including intergenerational trauma. So you may not have had the trauma experience, but your ancestors did, and then it was passed down to you. So we don't pass down the trauma, but it's the effects of trauma. So here's the symptoms. The first one is what we call anhedonia, and that's the inability to feel pleasure or joy from normal activities like having a hobby, reading a book, interacting with friends. You may feel just an overall sense of numbness or emptiness instead. The second is a lack of motivation, having little to no drive or initiative. You may struggle just to get off the couch, to start or complete tasks, and just feel blah or apathetic, even about things you used to care about. And this can link to dopamine's role in motivation. Number 3 is addiction or substance use disorders or other compulsive behaviors. So gambling, disordered eating, etc. And again, that's an attempt to artificially stimulate an underactive reward system through highs and rushes of dopamine. Number 4 symptom is depression or anxiety. Dopamine imbalances are associated with higher risk for mood disorders like depression, as well as for anxiety disorders. Number 5 sign is trouble concentrating. Dopamine impacts focus and attention, so you may experience being easily distracted, bored all the time, racing thoughts if your levels of dopamine are dysregulated. Number 6, sleep disturbances, and we've done a couple of videos on sleep and their importance, but disrupted dopamine can cause insomnia, abnormal sleep patterns, or excessive fatigue. Number 7 is physical symptoms. Things like chronic pain, digestive issues, or lack of appetite can sometimes show up from dopamine system disruption. 8 is emotional numbness. We've mentioned that before. That's that feeling of being disconnected from your emotions, and you just can't deeply experience positive feelings. So that's all part of the dopamine reward system, and if it's out of whack, then you're not going to be experiencing those positive feelings. Relationship issues like struggles with intimacy, trust, and feeling socially rewarded from bonds can also stem from early trauma and how it impacts the dopamine pathway. So if you experience any grouping or cluster of these type of symptoms, it could suggest that your dopamine reward circuitry was affected by trauma at some point, either directly experienced by you personally or passed down generationally. So working with a trauma-informed therapist can help evaluate and provide targeted healing approaches, as we've mentioned so many times before. I want to give you another case to illustrate this. Javier is 42, and he comes from a long line of Colombian guerrilla war survivors. He's a high achiever, but increasingly relies on cocaine, gambling, and unhealthy risk-taking to chase that dopamine high. Javier feels foggy and bored otherwise. His marriages have crumbled due to inability to be emotionally present, and he wishes he felt the same love for his cultural music and dances that his beloved abuela did. So think about this. Like Javier, are there coping behaviors or vices that you've developed to compensate for an unrewarding inner state? How might trauma be impacting your relationships and your zest for life? I encourage you to journal about those 2 questions and ask yourself what you can do. So we've talked about professional help, therapy interventions that can help you reset the dopamine system, including trauma-focused therapy like EMDR. EMDR in research has actually been shown to help repair the dopamine disruption from trauma. So that is really powerful. The second is mindfulness and meditation, and that raises dopamine levels and can help restructure those reward pathways. So, even starting with some of the meditations that we've taught you here can help. The third is increasing exercise, which increases dopamine release and receptors and counteracts that numbed motivation. So, exercise is key. Number 4 is nutrition, and that would be focused on an anti-inflammatory diet, which can prevent dopamine depletion. Number 5, community bonds. Social support is always important in healing from recovery and maintaining some kind of cultural identity, some feeling of belonging or connectedness. Those feelings will boost dopamine release. So research has shown that feeling a secure cultural identity and connection to your heritage can be a buffer against the negative impacts of historical and intergenerational trauma. And that was a study done by the Native American researcher, Dr. Braveheart. So this cultural belonging appears to promote the resilience of the dopamine system. And here's some ways that it can help you. It can help restore motivation by finding meaning in cultural ties, a sense of purpose, values, and spiritual beliefs. And that can then replenish depleted motivation, which is a core dopamine function. So that's about looking for your why, and that can help dopamine release. The second is through social bonds as a natural reward for dopamine release. So social interactions trigger the release of dopamine, and cultural practices facilitate community, ancestral storytelling, and togetherness, which can reactivate the brain's natural reward system. Dopamine release is an exquisitely tuned mechanism, tuned to social interactions and bonding experience. But intergenerational trauma breeds isolation, mistrust, and insecure attachment patterns that will get in the way of this natural process. So if you have had intergenerational trauma, you may not be trusting enough to find a sense of purpose or belonging. So cultural means can, a kinship network and communal reciprocity can sometimes also be interrupted due to family dysfunction. And that's where the concept of your chosen family can come in. Maybe your biological family isn't there for you, but you can choose people to be your parent models. So this cultural thing will also help provide ancestral wisdom. And then feelings of acceptance, feelings that you matter and that you're seen authentically. These are positive social experiences that also help with dopamine. Cultural traditions create psychologically safe containers for you to be vulnerable and have it be safe. So these are some important ways that you can, really help your dopamine system heal without using substances or compulsive behaviors, without using food, without using drugs or alcohol, without gambling or sex addiction, and so on. Here's another case that I wanted to just tell you about. Amina is a 25-year-old, and she's re-embracing her indigenous cultural identity after her parents survived the Iraqi occupation. She finds that spiritual ceremonies, dancing, and community bonding help her dopamine reboot, and that boosts her mood and motivation and social contentment. She feels a greater sense of pride and a feeling of connectedness. So here's your reflection question. What ancestral or community-based practices could you reconnect to access these natural reward experiences? How might reclaiming your cultural identity shift your self-perception? So in conclusion, trauma that's experienced by our ancestors can create identity confusion, low self-worth, and disconnection between our roots. And that can happen to future generations. This then disrupts the dopamine system, which requires a stable sense of who you are and who you're connected to for optimal functioning. So this is part of the healing journey, is working on healing your dopamine reward system. And I've given you some, particular ways to do that. But most important is integrating your personal, cultural, and ancestral realms of identity into a unified narrative. Be a part of the narrative. Don't be separate from it. Own your own narrative, and this then will help you heal the dopamine reward center. Thanks for listening.